Assalamualaikum warahmatullahi wabarakatuh. Hi, my name is Muhammad Arif Muazzam bin Khalil Anwar. I'm from SL 1133D1 and I'm from Faculty of Sports Science and Recreation. So today I'm going to present about the characteristic of circuit training. So what is circuit training? Circuit training is strength, endurance, stamina, flexibility, coordination, and muscle tone can all be improved through circuit training. It comprises up to 6 to 10 strength exercises that target various muscle groups and are performed one after the other with no or very little recovery time in between. Once the circuit is completed, you may get a longer rest before repeating it all over again. So each exercise is performed either for a number of repetitions or for a certain time before moving on to the next one. For example, you want to do n exercises in 30 seconds in between. So the number of circuits during one training session depends on the training level and varies from 2 to 6 circuits. Each circuit training session should begin with 5 until 10 minute warm up and end with a stretching session after that. So the benefit of circuit training is it will involve every muscle in the body. Next, it will get your heart rate up to 40% to 60% of maximum heart rate. Next is you can boost your metabolism in your body, not only burn your calories during training, but you also can burn 30% of calories more after. Next is to improve both cardiovascular and muscular fitness. Other than that, it's flexible and hence never gets boring because you can mix up different exercise and become a guru of trainer of yourself. The last one is adaptable to different fitness level. So the example of the exercise is squat jump, lunges, burpees, mountain climber, push up, sit up, and squat jump, and many more that you can improvise to your fitness level. That's all from me. Before that, I will show you 3 examples of the exercises. That is squat jump, burpees, and mountain climber. Thank you.
I heard you question my stability. You think I fall just like a guillotine, but I am here to stay, won't look away. The storm is coming, so you better start running. No, you can't control, feel it in my bones. I'm coming for the, coming for the. Coming for the throne. Coming for the throne. So you wanna be my enemy? You should've known I'd never kiss the rain. Ice runs in my veins, won't play it safe. I don't belong with your nobility. Who died and made you king of anything? You think that I'm insane?
So that's all for the exercises. So I hope this video can help you
and I will pass for my friend to the next slide. Thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Tariq Ikom Azamillah. My matric number is 2020-61582 and I am for class SR1331. Okay, for today, I want to present about circuit training duration. Traditionally, the time between exercise in circuit training is short and often with a rapid movement to the next exercise. Circuit training workouts are based around a set of number of stations that you repeat until your time is run out. So knowing how much time you have can help you determine how many circuits you will need to complete and how hard you will need to work. The shorter the circuit training workout, the harder you should be pushing. Anywhere from 10 to 55 minutes is ideal for circuit training. Since you are alternating which body part you are working during each move, there no need to rest between the exercise. For example, your arm get a break during squat and your leg get a break during push-up. Okay. Second, what intensity should circuit training be? Performance is usually trained and improved at 80 to 90% of MHR and or above. The duration of this intensity can be between 2 to 10 minutes depending on the fitness level of the participant. The rest will be in 3 to 1 ratio. 4 minutes of a circuit training will require 1 minute and 20 seconds of rest. And third, circuit training frequency. Your age and your circuit training goal will change your optimal frequency. If you are over 50, 10 to 50 repetitions are the recommended range and 2 days a week is adequate. If your goal is strength, you progress to heavier weight with a low repetition range and continue to keep the rest between exercise relatively brief. This type of high intensity resistance training requires more rest for adequate recovery. Maintain twice a week frequency and consider resting 70 hours between circuit training. For the beginner often train twice a week for 30 minutes. 3 other days should be activity like walking or hiking. After a few weeks, beginner may add 5 minutes to their workout. You should aim for 40 minutes, 3 days per week. But how often train and how hard you will need to work depending on your goal. You will get the best result for training 2 to 3 times per week. Okay, for the hormone response during circuit training is the circuit exercise has been shown to elicit a significant acute hormonal response. It appears that this acute response is more critical to the tissue growth and remodeling the chronic change in resting hormonal concentration. As many studies have not shown a significant change during the circuit training despite increase in muscle strength and hypertrophy. Anabolic hormones such as testosterone and the superfamily of growth hormone (GH) have been shown to be elevated during 50 to 30 minutes of post-resistance exercise, providing an adequate stimulus is present. Protocol high in volume moderate to high intensity using short rest interval and stressing a large muscle mass tend to produce the greatest acute hormonal elevation, compared with a low volume, high intensity protocol using a long rest interval. With resistant exercise, there is immediate increase in epinephrine and norepinephrine. This hormone increases blood glucose and important for increasing phosphate production, muscle contraction rate, and energy production. This hormone actually begins to rise prior to the resistance training workout. This is an anticipatory response of the body preparing for the challenging exercise to follow. Interestingly, the elevated blood glucose level do not typically lead to increase in insulin unless protein or carbohydrate supplementation precedes the workout. The increased uptake of the blood glucose by the skeletal muscle is occurring due to increase in function of the cell glucose transporter which increase glucose uptake and thus glucose metabolism in the muscle cell. Thus, regular resistance exercise training has been shown to increase the insulin sensitivity, meaning the body can intake and utilize glucose more effectively.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Hafizuddin bin Maksha. I am from SR1133D1. My matrix number are 2020848048. I am going to be the next presenter. Metabolic, cardiovascular, respiratory, adaptation, and muscular changes from circuit training. Metabolic adaptation to circuit training refer to change in body which allow it to utilize energy more effectively and efficiently. Circuit training is a high-intensity aerobics. Circuit training increasingly dependent on oxygen because the longer duration with less rest. This is some of the different metabolic adaptation occur. Physiological adaptation to longer duration training. First is temperature regulation. Longer duration training, especially higher intensity, will present more heat than other training types. The body adapts by becoming more efficient and effective at shunting blood to the skin to cool through sweating. The second one is body acidity balance. The body becomes better at tolerating fatigue, which is the accumulation of hydrogen ions with increased muscle acidity. The tolerance improves and the body's ability to sustain more exercise in circuit training. The third one is aerobic enzyme activity. The enzyme responsible to produce ATP aerobically increase their activity and help produce more ATP for use, eventually improving the endurance and capacity of the aerobic energy system. It can make the body go harder and longer without fatigue with these adaptations. The last one is lactate removal. The ability to remove accumulated lactate from working muscle cells for conversion back to energy is improved. The muscle is allowed to train at higher intensities to continue for longer by the helps to reduce acidosis in the muscle. Cardiovascular adaptations to circuit training. Circuit training places larger demands on the heart than any other type of training. These demands result in adaptations to the cardiovascular system such as: first, heart size. The increase in thickness of the muscular walls of the heart, particularly in the left ventricle. This will provide more powerful contractions. The left ventricle's internal dimensions increase as a result of increased ventricular filling. The second one is stroke volume. When the size of the heart increases, it will enable the left ventricle to stretch more and fill with more blood. The increase of muscle wall thickness also increases the contractility, resulting in increased stroke volume at rest and during exercise. This will increase blood supply to the body. The third one is resting heart rate. As cardiac output at rest remains constant, the increase in stroke volume is accompanied by a corresponding decrease in heart rate. The fourth one is cardiac output. Cardiac output increases significantly during maximal exercise effort due to the increase in stroke volume. This results in greater oxygen supply, waste removal, and hence improved endurance performance. The last one is blood pressure. People with blood pressure in the normal range experience little change in blood pressure during rest or with exercise. However, hypertensive people find that their blood pressures reduce towards normal as they do more exercise. This is because of a reduction in total peripheral resistance within the artery and improved condition and elasticity of the smooth muscle in the blood vessel walls. Respiratory adaptations to circuit training. Circuit training places larger demands on the lungs than any other type of training. These demands result in adaptations to the respiratory system such as: first, ventilation. Breathing rates increase with higher intensity training. This is more an adaptation from anaerobic fitness and muscular endurance training or higher intensity aerobic fitness training. This enables more air to move in and out of the lungs, enhancing gas exchange. The second one is lung capacity or volume. Lungs increase their ability to expand, enabling a greater quantity of air move in and out. Thus, is a similar adaptation to the increase in stroke volume in the cardiovascular system. The third one is respiratory muscles. The strength and endurance of the diaphragm and intercostal muscles improve. This results in an improved ability to breathe in more air for longer with less fatigue. Aerobic training tends to improve the endurance of respiratory muscles. The fourth one is capillarization in the lungs. More capillaries are formed in the lungs over time, allowing more blood to flow in and out of the lungs. This improves the uptake of oxygen as there is a greater surface area for blood to bind with hemoglobin. The fifth one is alveoli. The numbers of alveoli in the lungs increase to enable more gas exchange to occur. The last one is gas exchange. The exchange of oxygen and carbon dioxide improves as the gradient between each becomes larger. This occurs because the more oxygen used in the tissues and the more carbon dioxide produced creates a larger difference or gradient between the blood and tissues. Aerobic fitness training tends to improve the efficiency of the body's tissues at absorbing oxygen and removing carbon dioxide. Circuit training is a style of workout where resistance exercises are performed one after the other with little or no rest in between. The amount of muscle mass one can build will largely be impacted by nutrition and training parameters. Circuit training can definitely contribute to increase in muscle mass. Circuit strength training that incorporates higher load, higher volume, and smaller amount of rest in between exercise sets assist in building more muscle.
Okay, hi, Assalamualaikum. My name is Muhammad Haris Faisal bin Muhammad Razif. I'm from SR113 3D1. My student ID is 2020613026. Okay, next I'm gonna talk about who should follow the exercise for the circuit training. So the circuit training exercise is an excellent option to help people who want to lose weight along with a healthy diet. So for the people that should follow this exercise is people like in a condition of diabetes, high blood pressure or high cholesterol. This may be a good choice for them. So next, if it's intense, they must check with their doctor first. They might be better off starting with something easier, especially if they have any heart problems. Next, for the next point, if the people have diabetes, make sure they know what to do if their blood sugar goes too low when doing a circuit training exercise. Next, for the fourth point, if they have arthritis, don't do any move that put pondent pressure on painful joints like jumping jacks. Lastly, if it's a female person getting pregnant and she did a circuit training before getting pregnant, she can keep doing it if her doctor says it's okay. She needs to drink more water while exercise, and don't do any exercise that could make fall and get overheated. Thank you.